afternoon, everybody, and a very warm welcome to you joining us this afternoon for our second episode of This is Simulation. I'm so glad you could all join us today. This is Simulation is a brand new series brought to you by SimSkills, and it's championing the latest innovations in healthcare simulation. I'm Nicola from SimSkills, and I'm your host. And over the next few weeks, it's my pleasure to introduce you to our amazing guests. Each of our speakers works in different areas of healthcare simulation or in clinical practice, doing different job roles with different experiences, and they're going to speak to you about their area of specialism, sharing practical insights that you can take back to your own organisation for your own use. Just before we get started today, it'd be great to hear where you're joining us from. So please use the chat function, just pop in there where you are in the world, in the UK, it's university, NHS, college, where you're joining us from. It'd be great to hear from you and say hi. I'm sure lots of questions will be generated from today's session. So if you do want to ask a question, if you just pop it in the Q&A section, the Q&A box at the bottom of your screen, that's just so that we don't lose any questions through the chat. Everybody can see each other's questions as well. So if we get a lot, you can upvote questions too, so we can get to as many as we possibly can. Just in the chat, make sure that you have got the little button that says to everyone ticked, not just hosts and panelists. Otherwise, it's only myself and Arron that will get to see your message. So yeah, just change that to everyone, and then everybody can see who everybody is. And it's a great way that we can connect with each other as well. Today's session is going to be recorded, so if you'd like to share this with any colleagues afterwards, or you've got to pop off somewhere and want to watch the rest of it later, the recording will be sent to you tomorrow. So on to today's episode and today's guest. So we're really excited and pleased to be joined by Dr. Arron Thind. He is the creator and founder of SimEPR, which is the only simulated electronic patient record software available. It's a simulation product used in sim centres around the world, and said Arron created and developed it. At SimSkills, we speak to lots and lots of people in simulation who've got some great ideas for products, but taking that next step into product development can be quite a scary and challenging thing, knowing where to head to and how to get your product developed. So we thought it would be a really great session to hear from somebody who has already done just this. So I'm very pleased to welcome Arron to This is Simulation. Welcome, Arron.
Hi, everyone. Hi, thanks, Nicola, for the introduction. Nice to meet you all. Hopefully, some of you have already heard a bit about SimEPR already, but that was a great introduction from Nicola as well. I'm just going to share my screen, so you should be able to see a presentation. And so what we're going to be talking about today is how to take an idea and turn it into reality. And I'm going to be talking a bit about my own experiences through SimEPR and the kind of route that I took in order to take SimEPR from an idea to where it is now. And I think one of the things that's really important to say is this is going to come across like it's a very direct route, like it's a very clear step thing. But I think in reality, it really isn't. It's such a tortuous route where you're trying to navigate through various different things. But I think there are some core, almost like milestones or chapters that are really important to reach. And I think those are the things that I really want to highlight to you so that you get an idea as to how you should be navigating through this system. So SimEPR, a bit more information about it. It's a cross-platform, web-based educational electronic patient record that I created. And it's being used across the UK as well as Australia as well. And it supports the development of a digitally ready workforce. It's proven to offer higher fidelity medical simulation compared to conventional paper-based notes used in simulation training. And we've had feedback from faculty that it saves faculty time and resources associated with delivering training. Now, SimEPR wasn't the first idea I had. There are lots of different things that I had been working on. As soon as I finished medical school at university, I saw like lots of problems in healthcare, and I tried to build different things, tried to play around with ideas. Not all of them worked, not all of them went anywhere. And obviously SimEPR was the main one that really took off. But I think if you're somebody that's got their head full of all these solutions to problems they see on a day-to-day basis, the question is, how do you filter through that? How do you get those ideas and actually figure out what is actually worth me building? Because you could end up going through this whole pathway of building a product, whether that's an app or a physical device, and actually it turns out it wasn't really the best use of your time and you could have been working on something else. And that's where this comes in. It's called the lean canvas. You can look it up on Google. You'll see lots of diagrams that look similar to this. And what it does is it kind of takes individual aspects of your product, the problem that it's addressing, how it's solving that problem, what is the value proposition? So what is it that you're actually offering your clients or customers? Who are your customers? How would you fund this in terms of revenue? Because obviously a lot of things, whether if you've got a digital product, web hosting, the database, this all costs money, and you need to be able to make it financially sustainable. So these are all the things that you should kind of be thinking about. And you can literally make a table a bit like this and jot down the kind of answers to each of these questions. So before you even get to the point of conceptualizing or building your idea, it's really important to have an idea as to what are the problems it's solving, how it's solving it, and so on, before you get to the point where you're actually building it. Because you might do all of this and then realize, actually, I don't think this is really solving a problem, or this isn't the solution, or there's actually another product on the market that's already doing this, and there's no way I can make something that's better than that. So these are things that you should be thinking about. Now, what I did was slightly different. I did it in the same way as this, but I put everything together in a presentation. So I made something called a slide deck or a pitch deck. And what was quite useful about doing it that way is you're able to visualize things with diagrams. And it also means when you're applying for various different programs or you're applying to accelerators, which we're going to talk about later, but when you're showing things to people or pitching it to people, you have a presentation or a slide deck that's ready that you can either send to them or use as part of your presentation. So each of these sections would be a slide on your PowerPoint presentation. So you can do it either way, whatever type of person you are. If you're more visual, a bit like me, then you might find doing it as a PowerPoint presentation a bit easier. On the other hand, you might find it a lot easier to have everything together in a table, or both. It's up to you. And this was a slide from the very first presentation I made, the very first slide deck I made back in 2021 for SimEPR. So SimEPR hadn't even been built yet. I understood that there was possibly a problem with the way that we were doing simulation training and that we were using paper, but all of our simulation, our simulation involved paper, but hospitals were becoming increasingly paperless or using electronic systems. So I recognized or identified based on my own training experience that there was this digital discrepancy. And that's why you can see here, it says practical training for medical students remains paper-based. That's the middle point. Doctors graduate with minimal experience using electronic systems in patient care. This was based on what I understood based on my own training. And obviously, SimEPR is now used for a variety of other healthcare professionals like nurses, physician associates, and so on. But this was purely based on what my understanding of the problem is, because it was a problem that I had experienced as well as my colleagues. So what you want to do is try and put together 1 to 3 steps, 1 to 3 problems. So you don't want to have too many. Focus on some core problems that you know and understand. And then if something's a problem for you, that doesn't necessarily mean it's a problem for everyone, okay? So you want to try and identify whether this really is a problem, but also try and quantify it in some form or another. And it doesn't really need to be some sort of high in-depth analysis, research or like academic quality in terms of the quality of research you're doing. It just needs to give you a good idea as to whether this is worth proceeding. And there's lots of different ways you can do this. So you can send out some surveys. So this can be very fast and scalable, low-cost approach. So Google Forms, whichever, or type form, whichever format you prefer. send these out to your colleagues or send these out to your contacts to try and get some structured feedback to really identify whether this problem is really a problem for them as well. Then you've got things like interviews, so you can try and do some one-on-one conversations with, again, your colleagues, people that you might see as who might be customers for this product or idea that you have. Try and understand their behaviors and pain points. And what this has over surveys is it gives you a bit of deeper qualitative analysis compared to the surveys. Observational research is another approach you might use, where you're actually shadowing or watching people in real-world settings. And that allows you to see behaviors that might not otherwise be articulated by people in surveys and user interviews. Another thing that's useful is competitor and gap analysis. And that's essentially where you're looking at the existing tools, the existing products that people use, and identify where where the weaknesses are or shortfalls in these solutions. Do they not really solve that particular, are they a product that's for something else, but don't really solve that particular problem that you're trying to address? And the other benefit is you can use these existing solutions as a template to improve on. So it provides quite a useful framework for you. There's probably lots of other different things that you can do, but these are some things that, I thought might be, it's definitely not an exhaustive list. And you might be doing more than one of those things. So what I did was I did a Google form, so you can see on the left-hand side here, which essentially it just kind of crudely asked some questions about their simulation training experience, whether they felt like using an electronic system in their simulation training would provide a realistic experience, and so on. And I was able to use social media, Facebook groups, and so on to survey around 74 doctors, doctors and medical students, which covered quite a large geographical area of the UK, and to get their experiences, whether they'd used electronic system in their simulation training, none of which had, and whether they felt like it would be a useful experience. And there were some really positive results that we got from there, which then gave you more evidence as to whether that problem is really a problem worth solving. So once you get to a point where you've got a clear problem and you've got a solution you've got a clear problem, you've done your research and market analysis to demonstrate that that problem is a genuine problem that other people are experiencing as well. And then you've got an idea for a solution which can be logically shown to solve that problem. You then need to think about building something that can be used or tested, so a prototype. So you've got to go from that idea stage to a prototype. At this stage, it's really easy to start getting really creative and wanting to build everything that you want your product to do. But actually, the reality is you don't have time to do that, and you don't have the resources to do that. You need to start simple and with the minimum product that you need to test your idea. So the minimum prototype, it needs to have the key features, absolutely bare bones, to solve that particular problem that you're trying to solve. And you want to use the simplest tools and technology to build that solution. It could be things like using things like PowerPoint and Google Docs, all these sort of things. Try and use these things before you get on to building a full-blown product, unless you have the skills to do the computer program, for example. And this is where perfection will cost you time and money, because you can get bogged down trying to build too many features that actually didn't solve that original problem. That's going to cost you time, that's going to cost you money. Then it makes it difficult to test as well. So you end up in this cycle where you're not really getting anywhere. So to summarize, you're going to build a prototype at this stage, which is going to be the simplest thing possible. And for me, when building SimEPR, I already knew how to code in Java, which was a computer-based language. So I built a computer version app or a desktop app of SimEPR. There was no database, there was no user login. You were not even able to build your own scenarios on the platform. And Those of you who use SimEPR who are familiar with pushing results to the students and so on, there wasn't any of that. There wasn't even a proper job chart. So that was kind of like the first version of SimEPR. This is what it looks like, or looked like back in the day. And once you've built your prototype, well, actually, when you're building it, there are a couple of things to consider. So in my situation, I was able to use some of the existing skills that I had. I learned to code when I was an F1 doctor after university, and that worked really well for me in terms of building a prototype for SimEPR. But if you have those skills, you might be able to self-fund and use existing resources and learn the skills, or even learn the skills required to create the prototype or products. That's called bootstrapping. The next thing is to use no or low code solutions. So some of you might have heard of products like Flutterflow or Webflow, Glide or Bubble, and that allows you to build software products fast without any heavy coding. It's worth considering, though, that these do come at a cost. So even though you might be able to build a product using no or low code, there are often fees to use their products to do this. And then at scale, it can sometimes cost a lot more. And that's how these businesses work when it comes to providing their software for you to build using low code. But it's worth looking into if you were trying to simply just build a prototype. If you're somebody that doesn't necessarily have the skills required to create the product, so if you're looking at software products, building a software product, but you don't have any software development experience and don't really have the capability to learn those skills or the time to learn those skills, or if it's a physical product and you don't have those skills to build the physical product, an alternative is looking for a technical co-founder. So that's somebody that you can partner with and you can share your expertise in the field while they handle the technical aspects of building the product. Then last of all, you might be able to consider things like investments and grants. There are various healthcare innovation grants, either nationally or locally, as well as university funds, or even see if you can get some angel investors to pay for the development and validation. And that might require you to work with a technical founder if you get funding, or even build a team of people that you can work with to build that product or prototype. Over time, with piloting SimEPR and iterative improvements based on that feedback, I was able to take SimEPR from this desktop app that you can see on the left-hand side to the web-based cross-platform app that SimEPR is now, with a lot more functionalities. And this whole process of piloting it across sites and iterative improvements based on that feedback helped me to stay within that scope of solving that problem. So I wasn't building new features just because I felt like it. It wasn't based on what I thought was the right thing to do. It was based on what people like yourselves thought was solving your problem, essentially. So it no longer became, while my first slide deck was about, doctors aren't getting the right training experience and so on, because it was based on my experience. Over time, it became less about that. It was actually more about what your needs were and your students' needs were. And this is a diagram to see just how SimEPR went from just this very simple desktop app that was replicating an electronic patient record to this more advanced, complex product with multiple faces. So you've got the simulation mode, which is the electronic patient record, the controller where you can monitor the activity that the student or trainee is doing on the simulation mode. You've got the editor mode where you can build scenarios, and then simulated wards came in afterwards. That allows you to build wards of patients that you can monitor and push results and so on. So the product that you see now is not where it started, and it's this whole journey that's really, really important. And a lot of these things like the controller mode, the simulated wards, these are all ideas that kind of came, or developments that came afterwards. I never built the first version of SimEPR ever thinking at the time it would get to the stage where you'd have simulated boards or a controller where you can push results and so on. So there's a continuous cycle of improvement. You've got the whether it's you yourself with the technical skills, or you're working with a group of people or a co-founder that has those technical skills, you're using those skills to build new capabilities and features. You're then testing your product, and not necessarily testing, you could get to a point where you've got genuine clients using your product, but it's still really important to take on board their feedback and suggestions. And that collective insight and expertise of the clients is an incredibly powerful asset. And I think for me, building SimEPR, the collective feedback and insight of faculty across the UK has been absolutely instrumental for SimEPR to evolve into the product that it is now. So it's really important to remember that you've got the technical coding skills, which are important, or the relevant skills for building the product, but also you need to remember the customer feedback as well. Then last of all, you have your clinical skills or experience within medical education to translate the technical skills and the feedback from your customers into product improvement. So this is this really important triad of features that you need to take into account while improving your product. And if you lose one of those things, you're not going to make your product better. So it's important to take all these into account. Once you've got this data to improve your product, you're also able to use it to demonstrate what your product does. So while we were using data from multiple centers across the UK, this was actually a regional pilot that we launched in collaboration with NHS England across the Southeast region. So there were about 6 or 7 sites that were using SimEPR and using it as part of routine simulation training. So instead of the paper, they were getting rid of that and using SimEPR instead. And then we collected feedback data from students and doctors who were using it at the time to capture their subjective experiences. We also did something similar for faculty as well. That data was used to improve SimEPR, but also we're able to use this very same data to demonstrate to other people that actually, yes, SimEPR does what it says on the tin. It does improve training. We've got feedback saying it creates a more realistic training experience. We've got feedback saying that trainees felt that it augmented their clinical learning. And we've got feedback saying that trainees recommend their departments to continue using SimEPR. So you can use that data in a lot of ways. And we went on to publish this and present it at ASPE as well. This is what the journey might look like. But as I was saying at the beginning of this presentation, it's really not a straightforward journey like this. It's all over the place. It's really difficult because sometimes it's so easy to get lost in terms of whether this product's worth building, and then you build it. Is it going to solve the original problem? So it is really difficult. And maybe I've made it sound a bit easier than it actually is. It takes a huge amount of time, a huge amount of resources. But like I said, these are key milestones you should be really looking at to orientate yourself. So the first step before you get anywhere to even building a product is doing a lean canvas or a pitch deck to really conceptualize the problem, conceptualize the solution, and identify whether that is a problem worth solving. Then you need to consider in step 2, is this worth building? Is it a financially viable and sustainable solution that I can build here? Step 3 is learning, kind of teeing yourself up to building the prototype. So learning the skills needed, or building a team, or finding a co-founder so that you can build that prototype. Then is step 4, which is building the prototype. Step 5 is testing and piloting it. Step 7 is consolidating that feedback and data from your test sites. Then you use that feedback data to iterate, improve your prototype to something called an MVP. An MVP is a minimum viable product. So that's it's a step above the prototype in terms of it's not as bare bones. It still has the features to solve the problem, but it only has the features to solve that problem, nothing extra. And then you keep, I've gone straight to 8, but actually reality is 5, 6, 7 kind of goes in a loop around and round. you're constantly, using that product that you've built, taking it back, collecting feedback, improving it, and so on. And each time your product gets more and more advanced. And while you're doing that, so, you're going around stages 6 and 7 again and again, you're also doing step 8 as well, which is where you're scaling it. You're getting it across to more users. And with more users or customers, you're able to collect more data and you're able to build an even better product. And that's the way I like to think about this whole journey that SimEPR has been on and is still going on as well. The last thing to really mention is that there are also organizations who are out there that can support you. And I've definitely had some excellent people who have worked with me from other organizations that have been really instrumental to taking SimEPR further. The first thing to mention is AHSNs, which stands for Academic Health Science Networks. These are regional innovation hubs that help innovators test, evaluate, and scale health technologies. At the time, I was around the Surrey area, so I was working with Kent Surrey Sussex Academic Health Science Network. I think their name has changed more recently. I think it's Innovation KSS or something like that. But essentially, every region that you're across the UK is split up with different AHSNs, and you can get in contact with them, and they are there to support you and take your idea or your product further, or even connect you with other people. The next thing is accelerators. I was on a few accelerator programs, one of which was the LSBU Simulation for Digital Health program. I think the name's changed now. I think it might be LSBU Startup, but there are lots of other ones out there. I was also on the Digital Health London Digital Pioneer Fellow program. So it wasn't an accelerator, but it was a program run by Digital Health London, and they also have their own accelerator programs too. So it's worth having a look online, what kind of accelerators are available to you either nationally or locally. They provide mentoring, funding, networks. They can even provide resources for product validation as well. There are NHS programs, so anyone who's perhaps in an NHS trust might be able to access these. There's the NHS Clinical Entrepreneur Program. If you have already got a product and you want to join what's quite a prestigious accelerator program to take that further, the NHS Innovation Accelerator could be quite a useful one. From my understanding, it tends to be quite advanced level, so products that have already got quite a lot of that have already been built and got quite a big routing already in the NHS as well. But it's worth having a look online and seeing what that's about too. Then there are local innovation hubs. For anyone that's working in a hospital or a university, there might be a team like a research and development or an innovation department that is there to support individuals who are innovating. Might be worth having a chat with them to see if there's any extra support that they can offer, and perhaps even some funding as well. And on the topic of funding, there are research and funding bodies. So you've got SBRI, UKRI, Innovate UK, lots of other things online that you can have a look at. These do tend to be quite competitive as well, but AHSNs and accelerators might have the resources to help you kind of apply for those funding programs and, might make it more likely to be a successful application. Then last of all, I've heard the team at Sim & Skills mention on various occasions and conferences about innovators getting in touch with them. So perhaps it might even be worth a pitch to Sim & Skills. So once you've got your pitch deck ready and you think it might be worthwhile pitching to Sim & Skills, why not? It might be worth a shot doing that as well. So that's the end of the presentation, everyone. Thank you for your time. Thank you for listening. And I'm happy to answer any questions at all that people have.
Thank you so much, Arron. I've known you for a couple of years now, working with you on SimEPR, and just to hear the work that you've had to go through. As you said, that presenting it in a slide deck can make it seem quite a simple, straightforward process. The reality can be quite different, but actually what you've presented, particularly those bits about, the funding opportunities, and there are organisations out there that can help you. I think it definitely will open quite a few people's eyes up. There are possibilities. You don't have to feel like you're on your own developing this. And I would say definitely to anybody who is thinking they've got a product in mind, do check to us at Sim and Skills. It is something that we do. Our team are set up to help and support, and even if it's not quite right for us, we can guide you in the right places to help you get started as well. So we have got quite a few questions in the Q&A, Arron, so I will field them to you now. So Elise has asked, some people consider medical simulation quite a small market and hard to prove that business will make money. What's your experience with this, and how do you prove the market value?
That's a really excellent question, and it's actually something I came across quite a lot when I was pitching SimEPR to people. So when you compare medical simulation, the medical simulation market compared to a lot of other markets, you are right, it is a relatively small market. And I think when you're speaking to people who have a venture capital background, for example, in their mind, they're thinking of, the value of a market being billions rather than millions, for example. Their mindset is completely different. And I remember a few times there are people that I presented SimEPR to who weren't necessarily medical. And I think that's a really important thing. They didn't have a medical or clinical background or even a background in education. They kind of shut SimEPR down. And that's because, like I said, they don't understand necessarily the problem, and their focus is more on the market value itself and the money that can be made. And I think if you're out there to solve, I think the focus should really be about solving a problem and building a good product that everybody or the people that your clients like to use. I think that's the most important thing. Focusing too much on how much a market is worth, that'll only put you down a few different avenues, and it probably wouldn't be in terms of different industries, and it probably wouldn't be medical simulation. So yeah, it's something to bear in mind, but I think it shouldn't necessarily deter you from building what it is that you want to build and solving the problem. It might make it a bit more difficult if you wanted to go down certain funding routes like venture capital funding. Not something I ever personally considered. But yeah, hopefully that answers your question.
I guess one of the other points to consider is that when you showed us that sort of process of how you develop a product, if you are thinking about the scalability of the product, that can certainly help as well. And in our experience of working with developers, thinking about how you can scale a product. And like you said, Arron, originally from your own experience, you were looking at doctors, whereas actually the true scope of your product has increased as you've spoken to other clinicians and found that it's got multiple uses across multiple disciplines, and not just potentially in the UK as well. So it's looking at also you don't know what you don't know when you first start, and the market could actually be a lot bigger.
Yeah, exactly. And even if you were to ask someone a decade ago what a particular, I think the other thing as well to consider is there are markets that don't exist yet because a product hasn't yet been made for it. So it can be difficult to say what's the value of this particular niche market where there isn't a product. You wouldn't be able to get an answer for it. So that's the other thing as well to bear in mind. I think my point is, yes, it is important to understand the market and understand what the market is worth. But I think the more important thing is to understand who your clients are, what your clients need, and how it solves their problem. And if you solve a particular problem for a customer or a client, it saves them time or allows them to do something they wouldn't have otherwise been able to do that they want to do, then generally speaking, people are willing to pay for that because it's beneficial to them. They value that. And I think that should be the focus of when you want to build a solution, whether it's worthwhile actually going ahead and doing it. I think that should be the key thing.
Thank you, Arron. Claire would like to know, when seeking co-founders, do you have any top tips on how to create a business agreement?
Yeah, that's a good question. I mean, I am, as someone who's a solo founder, I haven't gone through that stage yet. it is something that you do need to consider. I've been on the NHS Clinical Entrepreneur Program, there was a session on this, and you have to almost consider, even if they're a friend or a family member, or it's just a random person that you've met who you've connected really well with and both want to work together, you have to consider the worst case scenario. What would happen if that whole relationship fell apart? How would you split things up? So while I can't tell you the ins and outs of what that contract should have, there definitely should be something that outlines what would the situation be if the whole relationship between the two of you or the group of you were to fall apart. How would things be split up? How would the company carry on, or the business carry on, or the product carry on being built if the relationship fell apart? And the other thing as well to consider is intellectual property. Once you've built that product, or whether it's software or it was a physical product like a mannequin, how does that intellectual property get shared if there was a disagreement or things were to split up? Yeah, so definitely something really important to consider if you're going to be working with either one person or a group of people.
Yeah, I couldn't agree more. I run this business with my husband, and we have a contractual agreement, not just a marriage agreement, but it's just important in any business terms to have a standard legal document that just says, like you say, Arron, in the beginning, everything that's quite rosy, you just do not know what's going to happen in the future. So it safeguards all of you within that arrangement. If you do have the product that becomes successful, it's allowing you then to keep fairness in your partnership. Val would like to know, this is an interesting question as well, if you create a product as an employee, do you, the employer, does the employer own the product?
That's something you'd have to check in your employment contract. When I was building SimEPR, I was working as a locum. So, I'm not employed by anyone, and therefore it's effectively self-employed. But I do know that there can be situations where if you are an employee, there can be some issues with intellectual property and so on. It is worth having a look at your employment contract to see what it says about that.
Okay. Earlier on, you mentioned some no or low code websites. If anybody's got ideas about software they'd like to develop, what ones would you recommend are best to use?
So I've never, apart from Webflow, which I use for just static website development, I haven't really used a lot of no-code solutions. And the reason for that is because I already knew or know how to code, and I find I get a bit more control over the way the product is made and built. And for me, I think when it comes to, if somebody has found a bug or an issue with a piece of code or SimEPR, I know exactly what file, sometimes even down to the line of code that's wrong, because I wrote it. Whereas with the no-code solutions, you don't always get that finer granularity of control over what you're building. And that's why I've never really used them apart from for static websites. So if you're building a static website, Webflow, I recommend. It's really, really good. You can do lots of stuff with that. I do know that I code in a language called Flutter, which is cross-platform, and I know that Flutterflow is potentially a good software or a low-code solution to build a product on. All of these, though, when it comes to scale, the costs increase, so their costs get exponentially more. Webflow is relatively cheap, but like I said, it's not an app, it's not anything particularly advanced, just a website. But it's important to make sure you look at the pricing plans, because you might say, actually, all I want to do is build a prototype. All I want to do is show a proof of concept. And in that case, it might be completely fine. You're using it, you're testing it, you're showing some validation, and you might then go on to work with someone, get some funding, and actually build a proper product. But if you're thinking, oh, I built this prototype on, say, Flutterflow, and then you want to scale it, but not actually rebuild it, you're actually just going to, add on bits to make it into a full-blown product on Flutterflow, it's worth looking at the pricing, because you might find that those pricing start to go up, and everything costs money, you'll find. So Yeah.
So just while we're on code, Beth would like to know, is there a specific type of code that you need to know in order to create a product? I assume a software-based product.
Yeah, so there's so many different languages. I think that I would say it's get an understanding as to what it is that you're trying to build, and then looking at the different languages that are relevant to that. But I think that once you pick one, it's important to stick to it, because what you might find yourself doing is saying, oh, okay, I'm going to learn some Python because, I don't know, some of the stuff requires some machine learning or something, and I read that machine learning is good for Python. And then you start thinking, oh, actually, no, I'm going to learn a bit of React because React looks interesting. And then you start learning React. And then you start moving on to another language because you got interested by that as well. And then you find that actually you never learn anything. So some languages that are quite good, Flutter iCoding, which is Google's cross-platform language, web, mobile, desktop. React is one by Facebook, and that's also cross-platform as well, which can be quite useful. Then you've got the platform-specific languages. So if you wanted to build a web app, sometimes people use JavaScript, HTML, and CSS, which is the languages that you can use to build a website. You've got languages that are specific to certain mobile phone apps. So, for example, if you want to build an iPhone app, you can use Swift, but Swift doesn't work on Android. You could use something like Kotlin, which I think also works on mobiles as well. So basically, it depends on the product you're trying to build. It depends on the platform you're trying to build on. And you pick based on that. But once you pick something, it's better to stick to it rather than chopping and changing too much.
Hey, thank you so much, Arron, for joining us today. It was incredibly useful, incredibly insightful. I'm sure anybody in the call that's got even the faintest of idea of a product they'd like to develop has had some really good ideas about what they can do for the next step. And that's often, it was quite striking what you said earlier on about, was like, it's better to do something than nothing. That product's never going to get anywhere if you don't attempt to try. But there's obviously some useful organizations out there that can support you with developing ideas. So thank you so much for that today. We have got a SimEPR webinar coming up next month on the 23rd of June. There's a link going into the chat now. So if you'd like to find out more about the product that Arron has developed, we've got a webinar with Arron and a current user of SimEPR from the University of West London, Sam McNabb, and he's going to be talking about how they use SimEPR to support virtual placements for their nursing programs. So if you want to join us for that webinar, it'd be great to see you. And likewise, we've got 4 more episodes of This is Simulation coming up over the next couple of weeks on various different topics, including AI in simulation, simulated virtual placements, how to scale your sim center sustainably. And in 2 weeks' time, we've got a session all about using the right technology in the right place at the right time. So we really hope that you can join us for those sessions. There's a link going in for the rest of the episodes, or you can scan this as well. So thank you so much for joining us, everybody, today. And thank you very much, Arron, for your time and your expertise.
Thanks, everyone. Thanks, Nicola.